Hi, my name is Cameron Beans, and the first test I'm going to conduct is called the anterior and posterior load and shift test. So for this test, I'm going to have the patient sit down like she already is. Now I'm going to grab the affected shoulder up here in the top, and then I'm going to grab on the humerus, the head, right here. Now when I'm doing this, I'm going to compress and then move it anteriorly, and then I'll move it back posteriorly as well. So a positive sign would indicate that there was any excessive movement exceeding 25% or greater. In this situation, there wasn't really any excessive movement noticed on the test. And the pathology of the test is we're looking for any instability in the glenohumeral joint, aka the shoulder joint.
My name is Alex Searle. I'm going to be performing the apprehension test. So I'm going to have my athlete put their arm in this position, and then I am going to externally rotate their shoulder. A positive test for this would be apprehension, and it would be indicative of anterior instability of the glenohumeral joint.
My name is Cameron Searle, and the first test I'm going to be doing is the posterior apprehension test. So I'll have the patient lay down. And you're going to want to rotate 90 degrees. And you're going to want to load posteriorly. I'm just going to push down on. And so a positive test would be apprehension, and pathology is going to be posterior instability.
So for the second test I'm going to conduct is called the sulcus sign test. So this one, she's already sitting in the position. Actually, you know what? We'll have you face forward. So for this situation, what I'm going to do, I'm going to actually grab the opposite shoulder, and then I'm going to grab below the elbow just right here, have her relax. And what we're doing, I'll actually pull this up to a better view, is I'm looking for any divoting or dimpling in the inferior shoulder. In this situation, there wasn't any of those signs which would indicate that this test was not positive, and we are looking for pathology that would be indicative around the inferior shoulder as mentioned.
This next test is called the shear test. So what I'm going to do is I am going to compress the clavicle together, and I'm going to do it on both sides because I'm looking for pain and or laxity, which would be a positive test and would be indicative of pathology in the AC joint.
The next test I'm going to do is the sternoclavicular joint integrity test. So you're going to follow the clavicle, lead up to the sternum. Right over here, you're going to depress, and if there is laxity, it's a positive test, and the pathology is going to be the SC spring.
My name is Nicole Ardetta, and the first test I'll be performing is the drop arm test. So I'll have my patient actually face the wall here. Never mind, face the camera actually. And I'll instruct my patient to raise their arms above their head with palms out. And then I'll tell my patient to lower their arms down to their side. And a positive test would be pain or any uncontrolled movement, which would indicate pathology in the rotator cuff or possible rotator cuff tear.
The next test I'll be doing is the empty can test. So we're going to bring their arms out to 45 degrees, pretend they're dumping out a can, and you're going to apply pressure evenly on both. A positive test would be weakness, and the pathology is going to be the supraspinatus. So as you can see, this test was positive.
The next test I'll be performing is the infraspinatus strength test. So I'll instruct my patient to have their elbows flexed at 90 degrees and arms straight out. And then I will apply a medial force and have the patient resist that motion for external rotation. And a positive test for this one would be weakness, which would indicate pathology in the infraspinatus.
So for my next test, I'm going to conduct the speeds test. So for this one, I'm going to have the patient extend their arms like this in front of me, try not to bend your elbows. Now for this test, I'm gonna actually apply a force against him as he resists against me. So there you go, you can relax. So for this test, we are looking for any weakness in the biceps brachii unilaterally. So for this test, we're actually looking for pathology in the biceps brachii. In this test, it indicated there was no signs of weakness, which means that this test is not positive.
The last test I'll be doing is the pectoralis major contractor test. So what you'll do is the patient will lay supine, and they're going to put their hands behind their head and see if their elbows will touch. If the elbows don't touch the ground, it's going to be a positive test, and the pathology is going to be tight pectoralis major.
The last test I'll be performing is the Hawkins-Kennedy test. So I'll have my patient put their arm out like this, and I will support the elbow like this, and then internally rotate the elbow. If there's any pain with that movement, that would indicate shoulder impingement and possible pathology there.
For the final test I'm going to do, it's called the Craig test. So this one I'm going to have you lay down your back with your head facing that way, please, on your back. Are you good? You're fine. Sorry about that explanation. So as she's down in this position now, I'm going to actually grab her arm and I'm going to put it about 60 degrees above her head, or 160 degrees away from her torso. Now when I'm in this position, I'm going to then push axial compression into her joint right here, and then I'm going to move into external and internal rotation. Okay, you can relax. So the point of that test, we are looking for any pain and or clicking in the area. More specifically, we're looking for any pathology in the labrum. In this situation, there was neither of that, which means the test is not positive.
This final test is the compression rotation test. It's very similar to that last test, but instead it's going to be, the shoulder's going to be directly at 90 degrees, and I'm going to load the joint and then externally and internally rotate. A positive test would be pain, and that would be indicative of pathology in the labrum.